Greetings. I want to welcome you to the first workshop session of the 2021 Chisholm Annual Gathering. I'm George Graham, Vice President of the Council for Health and Human Service Ministries of the United Church of Christ, Chisholm. You are attending the workshop entitled Using a Trauma-Informed Lens to Create Hope with Reverend Samantha Jewell. Before I turn it over to Samantha, I want to thank our member, Bellwood and Brooklawn, who is not only the member ministry for whom Reverend Jewell serves as chaplain, but who is also sponsoring this session. And here's a word from Abby Drain, CEO of Bellwood and Brooklawn.
Hi, I'm Abby Drain, President and CEO of Bellwood and Brooklawn. In 1852, the German Protestant Orphan Asylum, now known as Brooklawn, was formed to provide care for German-speaking orphans in the Louisville area. Originally a home for children of immigrants, the organization was one of the first Protestant orphanages in the United States. In 2012, Brooklawn merged with Bellwood Presbyterian Home for Children, and today we continue our faithful work of healing the hearts and minds of vulnerable youth and their families throughout the Commonwealth of Kentucky.
Thank you to Abby and the staff of Bellwood and Brooklawn for all they do for children and youth and for sponsoring this session. Reverend Jewell has served Bellwood and Brooklawn for 22 years. During that time, she's provided spiritual care to the youth that require residential treatment. Reverend Jewell is a certified trauma trainer, certified juvenile sexual offender therapist, and has provided additional clinical and supportive services to the youth, families, and staff of the agency. Reverend Jewell is ordained in the United Church of Christ. We welcome her in leading us today to think about using a trauma-informed lens to create hope. After the presentation, there'll be time for Q&A and discussion, but you're welcome to enter your comments and questions in the chat anytime during the presentation, and then we'll have an opportunity to talk more afterwards.
Hello. I am Reverend Samantha Jewell, and I have been the chaplain at Bellwood and Brooklawn for 22 years. And it is my great pleasure to be a part of the Chisholm Annual Gathering and to present to you this workshop entitled Using a Trauma-Informed Lens to Create Hope. It seems odd that I can't actually interact with you right now, but I will be active, as will some Chisholm folks in the chat, and obviously we will have some time for interaction at the end. So hopefully I can share a little bit of my expertise dealing with ways to overcome trauma. So first, let's talk about what is a trauma. It can be just about anything, and as you see, here's the definition from SAMHSA. But a trauma can be anything from physical and sexual abuse to a car wreck, to tornadoes, to the pandemic that we're all dealing with right now. So each person's experience of trauma, they're going to interact with it differently based on their history. Could be based on their amount of intelligence. It could be based on their own experiences. If we all stood together and all witnessed a car wreck, we would all interact with that differently based on our own experiences. And the folks that we work with every day, whether they be our coworkers or our clients, they are the same. So let's talk about ACEs. ACEs may be something that you're familiar with, or this may be the first time you've heard of this. It was actually a study started in the 90s out in California through the Kaiser Permanente healthcare system. And there were a group of doctors there. So they had folks with private health insurance before the ACA. So again, you'll need to understand kind of the socioeconomic level of the folks that they did the initial study with. They partnered with the CDC, and it was the largest study of its kind ever done. They were talking with adults and asked them, did any of these things happen to you before the age of 18. And they found these 3 types of ACEs. They found abuse, neglect, and what they determined as household dysfunction. Obviously, we get that experiencing physical, emotional, or sexual abuse as a child, or physical or emotional neglect, is going to have a long-lasting negative impact on you throughout your life. But they also found some things that folks at the time had not really even thought about. They found what they determined as household dysfunctions. So having someone be incarcerated, having someone dealing with substance abuse in your family, and obviously those things go together, having someone with mental illness, divorce, or having the mother treated violently. One of the things that when I talk about ACEs that I often say these are 10, but really if we look at an overarching issue, I would say that there should be 11. That poverty should also be on this list. But again, because the initial study was done with a group of folks who had private health insurance before ACA, they did not find that. So what we need to understand is how common these are and what are the outcomes. So here's the reality, that as the number of ACEs that you have experienced goes up, so does your risk for negative health outcomes. So if I have 2 ACEs, say there's been domestic violence and divorce in my family, that puts me at higher risk than someone with 1 or 0 ACEs. So here's what they can impact as adults. So there's behaviorally some things, right? Lack of physical activity, smoking, alcoholism, substance abuse, missing work. But then there's actual physical and mental health issues that can come out of having more ACEs. Obesity and diabetes, which obviously can be linked to the lack of activity. Heart disease, cancer, depression, stroke, suicide attempts, STDs, COPD, and broken bones. So obviously none of these are positive outcomes that anyone wants for their adult life. They all have compounding negative impacts. And what the study found was that it only took 2 ACEs to dramatically increase your risk. And here's where we can see how prevalent these ACEs are. And again, this was of the original 17,000 participants. And so it was only a third, just slightly over a third of the population that had 0. So 64% of that population, of mostly white college-educated folks that were in financially safe environments, had at least 1 ACE. That's astonishing, and it's frightening. And when you look at current numbers of ACEs, if you add in poverty, and if you look at the increase in substance abuse issues and incarceration having to do with the addiction crisis, these numbers are much, much higher now. We also ended up having some knowledge that the initial study, because it was done with mostly white college-educated folks, had some severe limitations. And so they've come out with this pair of ACEs, this idea that there are not only adverse childhood experiences that happen within your home, but there are also community environmental factors that are very common. So if you Google the Philadelphia study, it will actually ask more of those questions that get into poverty and discrimination, lack of economic opportunity, and poor housing. When you add these ACEs to the initial ACEs study, and you think about 2 or 3 or 4, you can start counting up your own ACEs. And you can start thinking about how much impact this has on you, your entire life cycle. But that's not the end, which is the good news. So as a preacher, I have to preach a little good news. So here's my good news piece. We also have the ability to have resilience, to be able to adjust or overcome the effects of ACEs and toxic stress. So let's talk a little bit about what those actual physical effects can be from the toxic stress that come from ACEs. So it is going to change your neural pathways. So if I'm a person who grows up in an environment where I have to be afraid all the time, where I have to be on heightened alert all the time, and I'm growing up in that environment, there is only so much energy that goes into forming the neural pathways in my brain. And if I'm having to worry about fight, flight, or freeze, that's the part of my brain that becomes well endowed. And that leaves less energy for the connections that I need in my frontal cortex to be able to make good decisions, to be able to think through consequences. Now, that doesn't mean that my brain is never going to get better. That's not what we've learned. Our brains change our whole lives. But if you've done any research in brain development and in neural pathways and how they develop, we currently know that it takes about 21 days for a new neural pathway to form, a new habit to form in our brain, doing one behavior consistently. Think about all of the behaviors that you have learned in the last year, good or bad, your Zoom use, your mask use, your hand washing. For those to become your new habit, you have to do that one behavior 21 days in a row. That's how we go about building resiliency. It takes time. It takes lots of time. And sometimes we feel like we don't have that time in our work. So we need to build a system that our clients and our coworkers get to live in that is trauma informed. And these are the 4 R's that, again, come from SAMHSA's research. We have to realize how widespread the impact of toxic stress and ACEs are. We have to realize how common these factors are. We have to be able to recognize the signs and the symptoms of trauma in our clients and our families, in our coworkers, and in everyone who's involved in our system. And we have to be able to respond by integrating that knowledge that we have about trauma into the ways that are most helpful to talk to people. And we can do this not only in the way we reach out to, say, a potential patient coming through our ER, if we're a hospital, or to a new resident in our long-term care facility, or for one of the kids that I work with who have already had multiple traumas and are coming maybe with everything that they own in a black trash bag to our residential treatment program. We have to be able to respond, and we have to resist re-traumatization. And we're going to talk about the way we become re-traumatized as the staff when we work with folks who've experienced traumas in their history. So we've kind of gotten a big picture of the prevalence of ACEs, how toxic they can literally be to brain formation and to who we are and to our sense of self. So how do we build resilience? Well, there's been a ton of research done on this, and I want to focus on these 4 pieces that come out of the Center for the Developing Child at Harvard. Relationships. This is the number 1 factor. So as a church person, as a chaplain, the way I talk to our staff about this is I remind them that the number 1 factor as to whether or not one of the children that we work with is going to be a statistic, end up homeless or dead or in jail, or to be a success story, the number 1 factor is us and experiencing unconditional support and love from a caregiver. It's not just for the kids that I work with or the kids that other child and family agencies within Chisholm work with. It's for any person who's experienced trauma anywhere in their history. So you may be thinking to yourself, I'm working with older adults. What in the world do I need to worry about what happened to them as children? That may be a large part of the reason why they're in need of your services as older adults. And you need to understand how to be trauma-informed as well. And you've got to build the relationship with them because that's the number 1 factor to assist them in overcoming whatever's happened and to lead them towards resilience. Some other factors is having a sense of control. None of us like to feel out of control. All of us want to feel like there are things in our world and in our life that we have some sense about and that we can fix and have a choice. So whenever possible, especially thinking about someone coming into a hospital setting or to an assisted living facility or into our care, they have very little they control. So we need to give them choices whenever possible. And then we have to learn how to self-regulate. Some of us are better at this than others. Some of us have more practice. And it is a skill that can be learned. So we give opportunities to practice things like deep breathing and mindfulness. These are important skills that we all need. And then we have opportunities for cultural and faith affirmation. That's a huge component of who people are. And if we don't mobilize their faith and their hope and their cultural traditions to assist them in this process, they are not going to be able to be resilient and to overcome the factors that have negatively influenced them to this point. So, what do we do, right? If you're a Chisholm agency and you're listening to me, you're thinking, gee, that's a pretty big scope. How do we start to embody trauma-informed care practices where we work? And how do I do that for the people that I serve? Well, for one thing, it's not just the people you serve. Your coworkers, your staff are people too. And they've all had ACEs as well. They've all had traumas and experiences that shape how they move through the world. And so one of the big components of being a trauma-informed care facility is not just how do you treat the kids or the family or your patients or the elderly folks that are with you, but how do you treat one another? And how do you take care of your staff? These are some of the critical questions. Because if the number 1 factor as to whether or not someone will be able to be resilient and overcome trauma that has happened to them and overcome the effects of toxic stress and ACEs, is having at least one person who is self-assured and who cares about them unconditionally, then self-care is not just a nice thing that we throw around. It's a moral imperative. Because if having a relationship with someone is the key to them being able to overcome trauma, if we don't take care of ourselves and take care of our staff so that they can build those relationships, we're not going to be able to do anything for the folks in our care. So again, it's not, we don't talk about self-care because it makes us feel good. Or if you're like me, you don't think about self-care as one more thing on your to-do list. But it is part of what we have to do if we are going to be able to meet folks in the midst of their trauma and change them. I will tell you that vicarious traumatization is real. So because you care about people in your work who have experienced trauma, and because you build that relationship with them, you are going to experience some level of that trauma. So even if you came into this work and you had the most perfect childhood and you had no ACEs, because you're in this work, you have now experienced trauma. So you have to learn how to manage that for yourself. So if you think about that, it's kind of like if you think about any other job that has a risk factor that's just part of the environment, right? If you think about a coal miner, part of their risk for their job is literally the air that they are breathing when they're in the coal mine. Part of the risk of our job, because we care about other people, is in the air that we breathe, and it's vicarious trauma. So the first thing you have to do is notice your own symptoms, and they're going to look different. And don't just think that just because maybe I'm in finance or I'm in HR, these things don't apply to me. It only applies to the folks that are in the frontline relationships with the clients that we're serving. You deal with people, even though you may want to think that you're only dealing with your computer. You are still at risk because you are in this work. So once you identify your own symptoms, maybe it changes your worldview so that everyone that you see, you think the worst of. For myself, in addition to being the chaplain and to have helped out carrying a caseload as a therapist over the years and to do some case management, because just like any other nonprofit, you wear lots of hats in this work. I'm also certified to treat children with sexual behavior problems and juvenile sexual offenders. And at one point in my career, I was doing 3 of those groups a week. And my 2 children that I gave birth to at the time were 10 and 5. Well, if I'm spending, 6 hours a week talking with kids and helping them to understand their inappropriate sexual behaviors towards others, and then my kids want to go to McDonald's and crawl around in the play area up there where I can't see them, I'm a little nervous. That was part of my symptom for the work. It wasn't because the kids that I was working with at work had done anything wrong. It wasn't that I'd done anything wrong. It wasn't that my children were doing anything wrong by asking to go into play. But I had to understand that this work was changing my worldview. And I had to figure out how to combat that. So one of the things that I did at the time, mind you, I was much younger then, I realized that coming up with a project for my home was a good way to combat what I was dealing with at work every day, because I could see a beginning, a middle, and an end. That wasn't something I got to experience every day at the office. So I would do things like tear out my bathroom sink and put in a new vanity and repaint the whole bathroom in a long weekend. That was rejuvenating, believe it or not. Now I've kind of adjusted my sights some because I don't have quite the energy that I used to. But I still find it important to have projects where I can see the end. So not only is self-care and a moral imperative for us, we had to figure out how to make ourselves continue to feel that sense of hope so that we can continue to share hope with others. That's the big job. So here's some ways I want you to think about this. I want you to focus on building relationships. And this doesn't just mean with your clients or your patients or the families or whomever it is you serve, but with your coworkers, with the folks in the next office that maybe make you a little crazy sometimes. Those are the folks that we need to continue to build the relationships with. Because whomever we come in contact with, they're going to have an impact on the folks that we do serve. And we have to empower people. Again, giving people choices and things that they can feel good about themselves and about the work that they're doing is critical. Do something like teach mindfulness. I've actually started for about 2 years now, sending out a newsletter to the staff with 2-minute mindfulness tricks and reminders to take care of themselves and their things that they can share with the kids. Think about having a mindfulness minute in your staff newsletter. Think about ways that you can teach them ways to self-soothe so that they can pass it on to those that you're serving. And then obviously, as a faith-related organization, give those opportunities for people to explore their faith and their culture. In some settings, it is easy to offer prayer resources or worship opportunities. In some settings, you may have to work a little harder to find the ways to allow people to do that. I remember years ago when we had our first practicing Muslim youth that came to our residential program. And there was some question about, can we do this? How do we allow this child the opportunity to pray? How do we meet their dietary requirements? But we did. Because as a leadership person within the organization, I said, this is important for this child and we've got to meet them where they are. And I know many of the agencies that belong to Chisholm have already done this. And you do this on a daily basis without any issue. So here's the takeaways I want you to remember. ACEs and toxic stress affect everyone. I don't know of anyone who's not had at least some exposure to some level of trauma. But we can build resiliency. We can build relationships with people. We can give them a sense of accomplishment and a sense of control. We can build in ways to have that relationship with them. And I want to make sure that you remember that you need to take care of your staff and to take care of yourself. Because if we don't take care of ourselves, we won't have anything to build relationships with the people that we serve. So I hope just this brief look into ACEs and the idea of toxic stress and the idea of how to combat those things and build resiliency. And I hope that you realize that the takeaway is all about building hope. We have to give others a sense of hope. And you do that through relationship and through all those other resiliency factors that we just talked about. So I hope that's been helpful. I've enjoyed the opportunity to talk to my computer, and now I look forward to actually talking with you and continuing this conversation and learning together. Thank you.
So here we are now, at least able to interact somewhat in, at least in real time, anyhow. So I guess I can start, and I welcome people to keep the conversation going in the chat and put questions in there, and we'll be watching them, and hopefully Sam will be able to answer or give some thoughts. But I guess I wanted to start and say, I just found what you had to say really encouraging for me as a parent of two teens, both who have mental health challenges and who have experienced trauma along life's journey. But it was just encouraging to think about the relationship as primary.
And, you know, some folks, you could kind of see that kind of like we do with self-care, right? We think, oh, yeah, relationship, that's not that big of a deal. But it actually is, and it's backed up by the science. It's not just Sam saying that or whatever, but it's, you know, it's what's backed up by the science.
Right, right. And I guess I was, one other thing that struck me so much in your talk is where I first learned about ACEs was when I was working for an organization in Cleveland called Adoption Network Cleveland, and learned about it around child welfare. But thinking about how that impacts people later in life, that is really a huge, that just opens things up in a new way. That really does.
Yeah. Because we don't, you know, you talk about the ACEs study and it asks what happened to you before you were 18, but you have to realize that that initial study was done with adults. And
Yeah.
that's see the health outcomes. Emily, I'm kind of laughing because I was reading your question. There were some days where I could just kind of think about the fact that it was okay to let my kids go and play. And there were some days that I just had to send them with their dad because I just couldn't. And part of that is my own self-care and figuring out what I could and couldn't do. And, you know, again, there were some days that were really good and I had no problem. But, you know, I talk with a lot of my coworkers and I'm sure that a lot of yours as well. You kind of get this idea that, you know, I deal with crisis all day. I deal with problems all day. I can handle anything. So like I'm driving home one day and I'm driving down a 4-lane divided, you know, byway in Louisville. And at that time, there was a middle school for the troubled kids in our county system. And their kids like right on this busy road fighting. And my fear is like, oh God, one of those kids is going to get run over. So before I even knew what I was doing, I pulled my car into the median and put it in park and was opening the door to get out and go intervene in these children fighting. And I thought, they don't know who I am. These aren't the kids that I work with. What am I thinking? So part of that could be a symptom too.
Very much so, I think. So you talked quite a bit about self-care. And do you have any hints or suggestions for how to put a a plan for self-care in place for your own self, and then think about it as we work with people, how to keep on encouraging. But let's start with your own self.
Kind of like the story I told when you were talking about your home and your home improvement and that kind of thing. Everybody has their own things, and what feels good to me may be painful for somebody else, right? So, like, one of the things that I did, especially early on in the pandemic, is I started painting. You can kind of see a few of my things behind me. I'm not the most artistic, but it made me feel good that I finished. So those are the things that you have to figure out. You can also think about self-care in different quadrants or in different spaces, right? So if I have someone that I'm working with that is looking me eyeball to eyeball and they're telling me the story and I'm starting to feel overwhelmed, I can't walk away and go paint a painting, right? So I have to have things I can do in that moment, like take some deep breaths and kind of keep myself centered. And then I have those things that I do long term. Or I may have rituals that I do after each shift. Now, if you guys are like me, you never get to leave your house and you're just talking to your computer most of the day. But when I used to go into the office all the time, I would literally sit in my car before I would get out and take deep breaths so that I could change my mindset before I went into the office and as I left. So develop those rituals. So those are different components of self-care that you can utilize.
Mm-hmm. Great. And in terms of encouraging, how do you encourage your coworkers to come up with a plan for self-care and practice it?
Right. Well, easier said than done, right? Because we're not perfect for ourselves. So how can we expect somebody else to do it? A lot of it has to do with changing the culture of your agency.
Mm-hmm.
I remember back in the day, we weren't quite as trauma informed, and it was kind of a badge of honor, like, how many PTO and sick days do you have banked? Right? I don't need time off, and that kind of badge of honor kind of stuff. Yeah, that martyrdom, Emily, right?
Mm-hmm.
Yeah, and so making the culture of the agency that it's good to take time away, that's a huge shift, right? And, Stephanie, when you're talking about building those secondary aces and building those relationships, if you build those true relationships with your coworkers, then it becomes easier to say, hey, you are being a martyr. It's time to go take some time off, right? If I have that relationship with that person, it's a lot easier for me to say that. Danielle, I love your idea about the room divider. That's a great idea. Yeah.
Yeah. So just a very physical boundary to guard work-life issue. Yeah, that is a really good idea, especially these days when so many of us are
Absolutely.
don't have the same kind of boundaries. We're not traveling between work and house. It can all be in the same room or 24/7. So that's hard. Emily is asking what stood out to you about Caitlin Curtis, if you had a chance to hear her regarding her own feelings of and processing her trauma.
I actually made a whole page of notes while I was listening. And thank you for teeing that up so nicely, Emily. You weren't even planted. But when she was talking about the importance of story and how so formative that is, what's really interesting is one of the most effective treatment for dealing with trauma is to use trauma-focused CBT therapy. And the biggest component of that is creating a trauma narrative.
Yeah.
And changing the story. So I found that just really kind of eye-opening, that she was talking about how story is not just telling your history, but also looking forward and looking into what you're going to change and do different. And that's actually the basis of, that component of treatment that we use with the kids that's so effective.
Can you say a little bit more about what a trauma narrative is?
Sure. Yeah. Using narrative therapy, having kids tell stories and then change the story. So especially with younger kids, one of the things that we may do, and this works with bigger people too, you just have to change the delivery a little bit. Think about if there was a superhero that was there when, someone hurt you, someone abused you. What would that superhero have done to save you?
Mm-hmm.
Right? Or who could have done something to make that different? There's also power in simply saying what happened and putting a timeline together and telling the story and telling the truth.
Mm-hmm.
She also talked about because once it's there on paper, you have more control over it, and you could literally tear it up if you need to, and change it. Sometimes with trauma that maybe happened even before they had words, they can draw. Maybe it's just colors. And again, you cut it up and make a new picture with it, just to retell the story. Yeah.
It's great. Great thought, great exercise. Stephanie,
and I think we can all do that.
Yeah, yes, right. And I guess that's the thing about what you're saying about ACEs affect us throughout our lives, but the kind of the exercises that you use with kids, we can use those throughout our lives. I guess I was struck, Caitlin Curtis mentioned a children's book this morning, and she said, but they're good for adults too. I mean, that's very true. It applies.
Yeah. I don't go anywhere without a picture book, really, seriously.
Back to the self-care piece, I think Stephanie Franklin was saying an accountability partner is really helpful.
Absolutely.
Yeah.
Yeah, great idea. Yeah, and sometimes your accountability partner may be somebody at work. During this pandemic, my coworker, my dog, my husband, whoever your coworker is, they may be able to call you out.
Yeah.
And remind
you. And I think that once again, either relies on relationship or builds a relationship. It's an opportunity. Can you help me with this? Yeah.
Yes. Yeah, absolutely. Yeah. One of the things that I heard in one of the thousands of trauma trainings that I've been to is that if you were broken in a relationship, if the trauma happened within a relationship, the only way you can fix it is in a relationship. So learning that relationships can be different and can change.
Yes.
So that's a big part of it. Yeah.
Michael Ann Wiley posted about remembering that the idea of secondary trauma is real for staff, but also for staff families, and about mindfulness, about children not overhearing trauma stories that we bring home from work.
Yeah. And I'd say there's a really strange balance. My children are older now. My daughter's 22. My son is 16. And their worldview is different because of the work that I do. I like to think that they have a broader worldview than some of their friends because they understand that some kids have different situations. But yeah, I try to be very mindful that they're not the ones working for Bellwood and Brookline. I am. And sometimes that's tough, and you have to kind of remind yourself. and figure out where those safe places are that you can talk about what's going on at work. And I'm sure that most of the agencies and stuff within Chisholm have like employee assisted programs and those.
Mhm.
And I 100% think those are good outlets for folks.
Yeah. Yeah, I know. So at the same time as this workshop, there's a workshop by Scott Brooks Cope, who's Director of Pastoral Care at Phoebe, and they have lost a lot of folks to COVID. So it's been a very traumatic period.
Yeah.
And of course, people working with older adults in congregate care right now, it's pretty traumatic. And he talked about what an uptick there is in the employee assistance programs there at Phoebe. Yeah.
Mhm. And again, that can be something that you have to really put into your culture. I actually talked about an EAP in another training I was doing, and one of the participants said, "Oh, that just gives me secondary trauma," because in her place of work, the EAP was used kind of as a way to beat you over the head and say you weren't doing a good job.
Yeah.
So you need to really be careful about how that's talked about in your agency. And that's what I'm talking about with the agency culture, because like, oh, I had to send them to the EAP. That's not helpful for folks.
Right. Huh. Well, I would, if anybody has not had a chance to get in yet with a question on the chat, I'd invite you to not hold back and go ahead and enter your questions. Did your, Sam, I was going to ask you, did your kids ever call you on being too protective?
Sometimes, yeah, they did. And I raised two pretty headstrong children, so they didn't hesitate. But the other side is also true. Like when my kids would, throw toddler temper tantrums, I wasn't impressed because I'd seen quite a bit more behavior at work. So really didn't get me that upset. I'm curious from folks that are on here, how many of you had you heard about ACEs before? Did you have that info, or was some of that new? If folks don't mind just saying knew it or new info in the chat.
Okay. So kind of half and half, maybe? Maybe not.
Okay.
Yeah.
Good. Okay. I'm always interested and surprised to think about, why isn't this more widespread? So.
Yeah. No, and I think, are you aware of people doing more work on impact throughout life and what that might be?
Yes and no. I mean, obviously the original ACEs study was done on adults, but I think it's the way it's portrayed in the media. It's only talked about kids.
Yeah.
So it's very interesting. One of the things that, because I've been training trauma and stuff with our staff for a long time. Oh, you didn't know about the ACEs? Okay. Or about Philadelphia. I'm glad.
Mm-hmm.
So because I've been doing this for a long time and we've used so many different treatment modules for the kids in our residential program, one of the things that I hear pretty consistently from our staff is that, oh, this only works with the little kids. And that may be part of where that ACEs mindset kind of gets pigeonholed, and it's not about. But when I was talking about how we form new neural pathways, right, and a new behavior pattern, a new habit takes 21 days to form that shortcut in our brain.
Mm-hmm.
That's why it seems like it's more difficult older folks or older kids, because it takes longer and you're building that many more different neural pathways in their brain 21 days at a time.
Yeah.
So it just takes a while.
Yeah.
And one of the things that I really push with the staff that I talk with is give yourself and the kids credit for progress, right? Don't expect that you're going to go from this point in your life to here tomorrow. But if you're making progress, give yourself credit. And it's also not linear, like a lot of things, right? You're going to take 2 steps forward, maybe 3 back, 2 forward again, and back and forth. And that's okay. And that's part of the process too.
It's a journey. It's a journey. That's for sure.
That it is. That it is.
Yeah, and I think just it must be so interesting to work on. I mean, you're working with the kids, but then staff too, in terms of some primary trauma that goes back to earlier in life, and the secondary trauma of what they're experiencing.
Absolutely.
Yeah.
Yeah. And Joey and I saw you in the chat earlier. Most churches, most congregations are full of folks with lots of ACEs.
Yeah.
There's been some research and stuff done that there's actually a higher percentage of folks with multiple ACEs in church communities as in the general population, because they're looking for that unconditional care.
So we are drawing close to the end of our time. And I think that I want to say thank you, Sam, for presenting and engaging with us. We're also really grateful for Bellwood and Brooklawn for sponsoring our session. In about 5 minutes, next on the schedule are affinity group meetings. For more details about those meetings, the groupings offered, you can look at your schedule. And following those presentations, people are welcome to stay in their groups for social time, which is being sponsored by Spencer Fain. And the groupings are, there's one for child, youth, and family work like Bellwood and Brooklawn does. There's another for affordable housing. There's one for long-term care, and there's one for advocacy. So you're welcome to make your choice or dip in and out of whatever you like. But once again, thanks so much, Sam. We really appreciate it, and look forward to having a chance to interact more throughout the conference.
Thank you so much. Thanks, everybody.